Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today. How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
See, you should remember one thing. Absolutely okay blood pressure is 120 by 80. Once you are crossing 120 by 80 and reaching up to 130 by 80, then it is a signal of alarm that you can cross it. So next figure that you have to remember is 140 by 90. Once it is persistently above 140 by 90, you are diagnosed as a case of hypertension. So three figure you have to remember: 120 by 80, 130 by 80, then 140 by 90. So roughly lower blood pressure can be 70 to 80. So this is how you can remember. But once it is above 140 by 90, persistently, repeatedly, then it is hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
Okay, so this hypertension that starts from lifestyle. So you have to faulty lifestyle, you have to correct the faulty lifestyle. First, you have to become physically active, decreasing sedentarism, more exercise. Then you have to change your dietary habits, taking more of fibers, more of vegetables, more of fruits, then less amount of salt intake, not more than 2.2 gram of the salt that is you have to take. So roughly around a 1 teaspoonful, half teaspoonful, not more than that, you have to take. That is the total amount of salt you should take for the whole day, and not to have further addition of added salt, and also not to consume salty food like pickle, papad, chutneys, breads and namkeen biscuits. You have to avoid these things, and also you have to avoid the packaged food, because that is most of the time that is rich in salt, acting as a preservative. Then you have to decrease amount of saturated fat, that is more important, consuming more of mufa and pufa type of oils, and doing regular exercise, sleeping at a proper time, and having some sort of yoga and meditation to avoid stress, and smiling more, that is more important. So these are the things you can take care of your blood pressure.
Can we say that hypertension can be treated without medication?
Yes, these are the things which I have just told you. Yeah, that if you change your lifestyle. But if there is a persistently high blood pressure above 140 by 90, you have to be on medication. Don't try to avoid medication, because it's a silent killer. So medication has to be there, and then regularity of medication and regular follow-up is more important, because it remains absolutely silent throughout your life. So you have to be on toes to manage it, because it can be damaging to your heart, kidneys and your eyes. Everywhere it can lead to damage.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
So you have to balance between the side effect and the efficacy of the molecule. The drugs which we are using nowadays, they are very good. They are very, very safe. But still, if you want to know about the side effect, there can be certain side effects, like there can be swelling in around ankles. Certain salts can lead to pedal edema. Certain salts can lead to dry cough. And so you have to talk to your doctor. And also sometimes you can have more over treatment of blood pressure that can lead to orthostatic hypotension or dizziness or syncope. These type of symptoms can be there. So most of us, we are using very safe molecule. But if there is something abnormal you find, then you have to connect your healthcare physician and get it corrected.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
See, most of the time, it's a lifelong commitment. Once you are diagnosed as a hypertensive, you remain hypertensive. You have to be on radar. It is not that you can say, I have cured hypertension. It never happens. So this is a lifestyle disorder. So lifestyle you have to change. Be regular on your medication. That is more important. Even if you are maintaining blood pressure of 120 by 80 or 120 by 70 and you are just asymptomatic, So there can be decreased amount of dosage that you can go, lesser amount of dosage, or the power of medication can decrease, but try to remain on medication, because these are very good medication that not only control your blood pressure but also give you lot of pleiotropic benefit in managing multiple issues in preventing the target organ damage. So it is always good to remain on medication if you are diagnosed as a case of hypertension.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
Yes, first you have to purchase a proper blood pressure monitoring device. That is important. That should be validated, or that should be checked by your healthcare physician. There should not be any error between the blood pressure monitor of the doctor or the hospital and your own blood pressure monitor you are purchasing. So it is always very good to check blood pressure at home, because now we are recommending that it is the office blood pressure which is most of the time is not diagnostic, it not giving you the exact values. There can be white coat hypertension, there can be masked hypertension, there can be nocturnal hypertension. So all these things can be there. So there you have to get the home blood pressure monitoring. Not only home blood pressure monitoring, rather ambulatory blood pressure monitoring is also very important aspect of management of hypertension. So if you are using the home blood pressure monitor, you have to check blood pressure right at the morning once you wake up, before meal, once you wake up from the bed, you have to check your blood pressure. Then at the night time, evening hours, when you are absolutely relaxed, no smoking, no alcohol, no caffeine take, and you are absolutely sitting in some silence for at least 30 to 40 minutes, then check your blood pressure. So always take 3 readings and take the average of that. So this is how you can monitor your blood pressure at home.
I would also like to know what would happen if high blood pressure gets untreated for years, and what parts of the body gets affected the most?
Okay, fine, you can start from above. If it is untreated blood pressure, then you are sitting on a volcano. The thing that can happen you can start from the above. You can have stroke, or you call it a CVA, or cerebrovascular accident, in the form of either ischemic stroke or hemorrhagic stroke. Then you can have problem at eyes, that can be retinopathy. Okay, then regarding heart, you can have all type of issues, like you can have left ventricular hypertrophy, arrhythmias, heart failure can be there, and heart attacks can be there. Then comes to your abdomen, that is your kidneys. The most vulnerable organs are your kidneys. Then kidneys get involved, you can go into chronic kidney disease, ESRD, and maybe requiring transplant or dialysis. So these are the important organs which are known as target organ. So these are the organs which you have to check, you have to screen while you are managing hypertension.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.